Alright, okay, so hello dears. Ayan, hello. And welcome to yet again another pre-recorded lecture in our class in Immunology and Serology Laboratory. And for this lecture, what we're going to talk about now is the first application of our labeled immunoassays, diba? The previous lecture before this, we talked about labeled immunoassays. So mga immunoassays na may label, ayan, so yung mga gusto dyan na may label, like me, charot. Diba? We want everything labeled, ayan. So again, labeled immunoassays, no? We have discussed the different types of immunoassays depending on the labels: radio immunoassay, enzyme immunoassay, fluorescent, and then of course chemiluminescent. All right. Now for this lecture, we're going now to look into one of its applications, the first disease that we can diagnose using those labeled immunoassays, and that is HIV. Okay, so we're going to talk about now HIV serology. All right, now, as I mentioned, diba, in the previous lecture in the labeled immunoassays, ang flow nato sa IS, diba, high precipitation, agglutination, and then the diseases that use those types of reactions for diagnosis, and then followed by labeled immunoassays, and then the different diseases na po that can be used, the different diseases that can be diagnosed using those types of immunoassays, diba? Actually, again, as I mentioned, the diseases then that use precipitation agglutination, recently then, most of the time, they can also be diagnosed using labeled immunoassays, all right? But for this part of the lecture, succeeding topics na gyud, hapit na tamahuman, remaining topics, we're going to focus on the diseases gyud that usually ang main method of testing nila or main immunological or serological tests that they use, they focus on immunoassays, labeled immunoassays, all right? And we'll start first with HIV serology. Okay, so very timely, very relevant to my country, the Philippines. Yes, so this is Pia Wurtzbach, 2015, charot, diba? Okay, so this is very, very timely, no? Very relevant, and it's one of the prevalent, and even one of the most pressing issues, no, in the 21st century, not only in the Philippines but also worldwide. So it's definitely much important. It's definitely significant, or it's definitely fitting, no. It's imperative rather for us medtechs to really focus on this or to discuss this disease and its diagnosis through serology, because again we can. It's in our field, and we won't be medtechs, no, if we don't know at least mangani how to diagnose this disease. And through that also our knowledge, again, as I mentioned, it's also part of our responsibility to educate people, okay, especially those outside of the medical field, especially those within your family, your friends, na wala kabulon sa nisya, okay? So that's an additional responsibility to all of us medtechs, okay? All right, ayan. So again, this is HIV serology. All right, so we'll start first with the virus, of course. HIV means human immunodeficiency virus, or some would say human immune deficiency. But it's usually human immunodeficiency virus. It's the etiologic agent of your AIDS, acquired immunodeficiency syndrome. Now, again, clarification, AIDS is now the mas ni grabe na siya. Okay, so HIV mag-start, but then your HIV, what happens is it weakens your immune system, which leads you now to acquire, okay, different diseases, opportunistic diseases, brought about by the destruction caused by the HIV to your immune system, okay. And once you reach that stage, you already are called you are a full-blown AIDS, okay, or you have already AIDS, acquired immunodeficiency syndrome, okay. All right, so at least you know that HIV and AIDS, that's different, okay. AIDS now is the parang intense, or parang siya na ang ni-progress, ayan, na version, okay, of the disease. HIV is the virus, okay, that initially starts the infection, okay, and because again of continuous destruction of your immune system, weakening of your immune system, you then develop AIDS, okay? All right, ayan. Okay, so walang namamatay sa HIV, but you can die from AIDS, ayan. Okay, all right. So again, of course, just a review of your virology. It's a member of your RNA virus, of course. Papa Adpo Hehe, your only DNA viruses. So viruses outside of the Papa Adpo Hehe, these are your RNA virus. And again, HIV is an RNA virus of the family Retroviridae, of course, by the name itself, Retroviridae. And of the subfamily lentivirus. Okay, lenti. Okay, linte. Kiligay nun man di ay. Joke! Yes, na-joke yung mga attraction to, mga Negros Occidental people. I don't know why. Tsaka lang. Okay, mga Ilonggo. Anyway, alright. Ayan. Mark, what's happening? What are you telling your students? Okay, mga private stuff. But anyway, alright, so two types. You have HIV1 and HIV2. HIV1 was discovered by they were discovered separately on the laboratory of both Robert Gallo and J. Levy in the United States and Luc Montagnier. I'm not sure how to pronounce that, no? Wala ko ka-search. But Luc Montagnier, okay, let's say, kay Frenchman siya. And of course, Robert Gallo and J. Levy in the United States. So early lang, very, very recent, 1980s. Okay, so mga 30 years ago. Yeah. 40 na, shucks. O mga 30 years ago pa pala. Yeah, 30 years ago. And HIV2, 1986, related siya to HIV1, but it's a genetically distinct virus. Usually, HIV2 can be seen or is prevalent in West Africa. Okay. West Africa. Okay. Alright. Ayan. Okay, so those are the two types of HIV, 1 and 2. Alright. Now, HIV was formerly called, yung old names, first is of course HTLV3, so human T-cell lymphotropic virus. It was also known as lymphadenopathy-associated virus, LAV, and lastly, ARV, AIDS-associated retrovirus. So these were its initial names, or this was the initial names of the virus before it was like studied well before they found out different characteristics. So these names were the first names of HIV. Okay, and there was a question in the board exam, not during our time, but recall, what was the first retrovirus? Ayan, so what was the first retrovirus? Okay, so what's your answer? Ako personally, katong nag-review pa ako, akong answer is of course HIV. Because wala akong kabalo na, okay na din lang yung retrovirus. Di ba, bugo? Anyway, yes, kulang among time sa virology sa among time. Kay gifuse ang mycology and virology in one subject, in one semester, and wala na human. So, sorry naman, no? Akong viro na knowledge, even myco knowledge kay kulang. But anyway, alright, so, actually, di ba, again, the question was, recall question, what was the first retrovirus? Nako, press the buzzer. It's HTLV. Nasa pangalan na, HTLV1. Ayan. So, nasa pangalan na, siya ang first retrovirus, the human T-cell lymphotropic virus. Diba? In your Viro Retroviridae, your HTLV, human T-cell lymphotropic viruses, are an example of retrovirus. Diba? So, they are part of the Retroviridae. So, if ang question again, board exam question, recall, what was the first retrovirus? HTLV1. Nasa pangalan na, don't be don't be fooled by HIV, yes. Siya ang ika-third lang, okay, na HTLV or retrovirus. Okay? So again, first retrovirus, HTLV1 or human T-cell lymphotropic virus. Okay. Again, those are its other names. Please familiarize, lumalabas din sa board actually. Okay, all right. Now again, to differentiate the two, as mentioned, HIV1 ang worldwide, predominantly worldwide, and as I mentioned, HIV2 is in West Africa. And as you can see, HIV2 is usually the less pathogenic, no? It's the less infectious then, and it's less deadly in a way. Ang HIV1 yun ang pinaka-intense, or siya yun ang mas ni-spread worldwide. Okay? Ayan. So siya ang worldwide in spreading, no? Or in the infection. Okay, all right. Ayan. Now for the virus HIV1, again, you have major groups pa. You have first is the group M. By the name itself, it's the group main or major. It has 9 subtypes and classes. Okay. Alright, ayan, sorry. So 9 subtypes or clades, from A to D, F to H, J, and K. So it's responsible for the majority, again, of HIV1 infections worldwide, ang group M. And aside from that, di ba group M, ihang subtype C ang predominant worldwide, whereas ang subtype B ang predominant in the US, in Europe, and Africa, Australia. Alright. Okay. Group N, another group of HIV1, is the non-M or non-O, or it's a new group. And you also have a group O, which is your outlier na group. So, actually different groups. Okay. And HIV2, it has 2 groups. You have group A and group B. Okay. Alright. So, but again, as I've mentioned, HIV2 is less it's less severe, okay, compared to HIV1. Okay, yeah, it's less pathogenic and it's also less to be transmitted or less iyahang rate of transmission compared sa HIV1. Okay, so HIV1 yun atong main. So most of the time, if we refer to HIV here in our lecture, we're talking about HIV1. Okay? All right. Yeah. Okay, now for the epidemiology, okay, just some basic facts. So some reports from WHO and WHO in 2007, so we'll start first with 2007, 33.2 million people are now living with HIV. 2.5 have become newly infected and 2.1 died of AIDS. And then in 2016, or 2015, sorry, 37 million, of course, there's an increase of people living with HIV infection. 1.1 has died. Okay, so as you can see, there was a significant decrease then in the number of people who died of AIDS-related causes. And recently, in 2019, ayan, pinaka-recent ako nakitaan, 38 million are living with HIV. 1.7 became newly infected in the year of 2019. And 25.4 now are receiving HIV treatment. And as you can see, those that have died of HIV-related causes are of very much, there's a significant decrease compared to 2015. Diba? 2015 is 1 million ba to? 1.1, yes. Now, it's only about 690,000. That's not like, I'm not saying that it's not bad, or like, I'm not saying that it's like, wow, okay. It's still bad because there are still people dying of AIDS. But if you compare the numbers, okay, it's definitely much better. Ang number, okay? All right, not the situation that, people are dying because of AIDS. That's very unfortunate. But again, what I'm saying is that the numbers lang, there's a significant decrease. And that's a good thing because it's saying that, people with HIV, people living with HIV can really pursue a normal life, okay? So there should never be any discrimination, any discrimination, any negative connotation when it comes to people living with HIV, because of the different treatment now, no? Although wala joy like bakayon ka na treatment yun na personally for HIV, but we already have like antiretroviral therapy or ART, which really improves significantly the lives of people living with HIV. So we can say talaga na murag, their life, although you have HIV, you can still pursue a normal life, okay? And, discrimination, negative connotations, whatever, have no place in this century for this disease and in other diseases or other situations that a person may have. Okay, wow, yes. Woo! Yes naman. Okay, yes. Fight, dapat lang. No to discrimination. Okay, all right. So those are just some of the statistics. That's worldwide. Okay, now we'll focus more on the Philippines. Ayan, so this is just some infographics. But as you can see, that is still on 2015. Okay, so latest 2016, every day in the Philippines, there are about 26 new people infected by HIV. In 2019, okay, 35 daw, so may mas nag-increase. In 2020, there are about 22 people daw, so medyo ni-decrease din. And then for 2021, as of January, there are about 21, tama ba? 29, sorry. Okay. 29 new people in a day, okay, infected by HIV. Okay, so as you can see, medyo dili gyud consistent ang data na increasing or decreasing, no? Medyo fluctuating. Okay? All right. So as you can see, it's quite 2021 is still early to say. It's still early to say if there's an increase by the number of new people infected per day or is there a decrease because it's still January. Okay? So January of 2021 pa. Muna ang latest data na ako na research or nakitaan. All right? Okay. And very recent, January 2021, according to the HIV AIDS and ART registry or HARP. So this is like a program of the DOH which gathers information every month of the statistics of HIV in the Philippines. Because again, it's one of the main pressing issues, good. And Philippines is one of the countries in Southeast Asia with the rising cases in HIV, okay, in Southeast Asia. So that's very alarming. It should be addressed. And according to here, there are about 890 new HIV cases recorded only for January 2021, which makes it a total number of cases natin in the Philippines 83,000 since January 1984. Because January 1984, this was the year that was the first case in the Philippines was recorded. Okay, and 172 had clinical manifestations of advanced HIV infection. So like padulong nag-AIDS, all right, or yeah, okay. And regions with the number of reported cases, number 1 is NCR, number 2 is Calabarzon, region 4A, number 3 is Central Luzon, region 3, number 4 yes, Central Visayas, region 7, and lastly the Ilocos region, region 1. Okay, now I've read or akong gi-research ang ubang mga HARP reports from the previous years. Mag-vary ang number of ang regions na ay most number of reported cases. But it's usually number 1 gyud ang NCR. Okay, and apoy Central Visayas gyud apil. So, guys, if you are very much sexually active, nothing wrong with that. Just practice safe sex lang yun. Samot na medtex mo. Okay, I'm not prohibiting you. I'm very much aware of how you are in the explorative stage and how much you want to mingle. Okay, and if you're into that, then go ahead. But again, please practice safe sex lang yun. Your medtex, you already know what you can acquire, what you can get if you practice unsafe sex. Okay, alam nyo na yan, from bacteria to viruses, pwede kayong may makuha. Okay? Ayan. Okay? As a teacher and as a friend din naman, no? Yes. Okay, alright. And as someone who... Joke lang. Joke! Okay, alright. Ayan. So, again, that's according to DOH HARP 2021. Okay, now for transmission, again, how do we acquire HIV, or how is HIV transferred or transmitted? Of course, we have 3 major routes. The first, the primary route is, of course, intimate sexual contact, which is the major route. 85% worldwide in the US daw, heterosexual ang contact. Okay? Worldwide, 85% of the cases kay heterosexual. But in the US, it's homosexual. Male-to-male contact. Okay. Yeah. Intercourse in homosexual males. Okay. All right. In the Philippines, I think the major route is still intimate sexual contact. And I think heterosexual din ang pinakamarami, if I'm not mistaken. No, I think it's homosexual pala. Male-to-male pa rin. Okay? All right. Ayan. So again, it's the major route. Can occur sexual intercourse. Okay? Even either vaginal or anal intercourse. Okay? Either vaginal sex or anal sex. Okay. So again, if you're quite uncomfortable, so apologies daan, but yes, we have to discuss this because again, it's a sexually transmitted infection. Okay? All right. Ayan. So again, the major route is intimate sexual contact. Okay. All right. And the presence of other STDs such as your herpes, gonorrhea, and syphilis was also increased the infection because of your disrupted or guba na yung protective mucous membranes. And since your mucous membranes are part of your natural immunity, the primary line of defense, diba? So, dito palang daan, if guba na siya daan, because again of your existing STDs aside from HIV, then of course, it can intensify or amplify the infection of HIV. Okay, it can help the HIV infect the body. Okay? Alright, ayan. So that's the first major route, intimate sexual contact. Number 2 is, of course, parenteral. So when we say parenteral, it's an exposure to your body fluids. Okay? So transmission has occurred through, of course, kanyang pinaka-common, sharing of contaminated needles by IV drug users. So, of course, tig-use-og drugs. And then, of course, if one has HIV, so, diba, drug users, usually they use syringes, diba, to inject the drug. And, of course, they share the syringe to inject from one person to another. So, of course, they're sharing the blood of the HIV-infected person from one person to another. So, ayan, that's this is the most common parang situation in the parenteral route of HIV infection. The second one is, of course, blood transfusions and the use of clotting factors. That is why, but nowadays, we have already testing for HIV sa atong mga blood products, okay? Sa atohang mga ipang transfuse clotting factors. So, this have been significantly decreased then, okay? And of course, occupational injuries with needle sticks, or other sharp objects. Yes, kita, we're very prone to that. Alam nyo na yan, since first year, we're very, very, very prone to needle stick injuries, okay? And it's definitely a biohazard. No, it's a hazard, occupational hazard to us medtechs, okay? Not only even medtechs, doctors, but in the healthcare field, okay? So, very important. Alam na yan, it's highly emphasized sa ato agyod not to recap needles, and if kailangan i-recap, you fish out the cap. Okay, so I have a chika, personal experience later towards the end of the lecture. Mag-chika ko sa akong experience. I think wala ko nakashare ani sa akong students last sem, but ako ni siyang i-chika. Okay, nakashare ko sa akong back test section, o sa ka-back test section, I think, yeah, last sem, pero wala sa ubang sections. Okay, alright, ayan. So again, occupational injuries. Alright, and mucous membrane contacts then in healthcare workers exposed to infectious fluids. Again, still the same. We're very much exposed to a lot of infectious fluids. So we could always be prone to these. Okay, so alam nyo na yan. Okay, all right. Now, body fluids considered to be potentially infectious. As you can see, blood, semen. Blood yun, pwedeng makuha through parenteral. Okay, blood. You have semen also, vaginal secretion, CSF, blah, 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 and other body fluids as long as they contain blood. Okay, all right. And the fluids that are not infections unless containing visible blood, you have saliva, sputum, nasal secretions, tears, sweat, urine, vomit, or feces. As long as wala sila blood, then it's not infectious, or you cannot transmit HIV through these body fluids. So through kanang kissing, if it's just plain kissing, not torrid or not intense kissing na magpaakanay na gyud, yes. Alam mo, pwedeng umabot dyan, yes naman. As long as there's no abrasions, walay samad ka sa imuhang baba, no? While you do kissing, and then walay blood, no? Nagsuyop ka or whatever, then you're quite safe. But if naanay samad, and then naay blood pag yun, and then nag-kiss mo, no, pak, lami-lami, pak, then, of course, the chances of getting the HIV is quite high. Alright? Okay, ayan. Okay, alright. So that's for the parenteral route. But according to CDC, the average risk of transmission to healthcare workers, nato, is about 0.3% daw. Okay? Kung percutaneous, meaning kanang matuslok daw tag needle, no? Percutaneous. Alright? 0.3% lang daw ang risk of getting the virus. And also, 0.09% daw after a mucous membrane exposure. Okay. So, kanina siya kay percutaneous, meaning example, nagamit ang needle, no? And then na ay blood of an HIV positive individual, okay? And then, tusok ta, percutaneous daw, the risk is about 0.3%. And then, kung mucous membrane, okay, so example, like, blood na butang sa imuhang, blood of an HIV-infected person na butang sa imuhang, let's say, mucous membrane, like sa eyes ba, or whatever, 0.09% daw. Okay? That's according to Stevens. I think sa Stevens ako ni nakuha. Alright? So, yes. But again, I'm not saying that you should be complacent, ha? Okay? That's not enough reason good. Not a reason to be complacent. Always have to be careful. Okay? Alright. So again, that's for parenteral. And the last major route is, of course, perinatal. From mother to infant. And how does the infant get it? First is during pregnancy, of course. Kung nag-HIV positive ang mother, pwede niya ma-transmit to the baby. Transfer of blood during delivery, of course. And lastly, breastfeeding. Okay, so those are the three major routes of your HIV infection. Okay, now for the next video, we're going to continue with the pre-recorded lecture. I think medyo mataas itong chika natin for HIV Serology. Wait, but anyway, yes, we'll start now with discussing the viral structure of your virus of HIV, which will then lead us to the different antigens, antibodies that we use for its diagnosis and detection. Okay? So I'll see you on the next video.